Hi there, you're welcome to Rx Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at Rx Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at Rx Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So let's talk about our medication of choice today. So our medication of choice today is Norethindrone. So Norethindrone is also known as brand name Camila, Erin, Micronor, Ortho Micronor, and other. All right, so what is important about Norethindrone? So Norethindrone is a medication that actually is used mostly as an oral contraceptive in order to avoid pregnancy. And the way this medication works is it actually thickens your cervical mucus, which is how the sperm is able to get into where it needs to be able to fertilize that ovum in order for it to become a fully fertilized egg that now develops into a baby. So what this does, like I said, is it thickens that mucus. That way the sperm is not able to penetrate properly. And also it affect the movement of the ovum towards the fallopian tube in order for it to get fertilized, as well as it changes that endometrium in order to prevent implantation of the egg that actually later on develops into a baby. All right, so to a layman language, so basically what it does, it kind of affects the way the woman's body feels. That way a baby is not able to kind of grow and develop in our female patients. So what is this medication used for? So the medication can be used for endometriosis, and usually in patients who use it for endometriosis, they use about a 5 to 10 milligram daily, and they usually not use that for about 6 to 9 months in order for it to help with the endometriosis condition. And this medication can also be used as a birth control, whereby patients use, the Camila that I mentioned earlier, which is about 0.35 milligram tablet a day, or patient can actually use this medication for uterine cancer as well. And the way this medication works, it actually reduces the abnormal uterine bleeding that occur in this patient. So usually in patients using it for uterine cancer, they use about 2.5 milligrams to about 10 milligram tablet a day, and they use it for about 5 to 10 days in order to help with that condition. So I know you guys are eager to hear about that side effect of this medication. So the side effect of this medication include changes in menstrual bleeding. It also causes, it may cause headache, it may cause tender breast, it might cause nausea, vomiting. It can also cause dizziness as well as fatigue in patients that are taking this medication. So those are the common side effects to look out for while you're on this medication. All right, so let's dive right into the serious side effect of this medication that you need to report to your doctor, or let your doctor know once you start feeling those conditions. So a serious side effect of this medication is known as ectopic pregnancy. So it is known that sometimes patients may get pregnant while being on this medication, and this could be an abnormal form of development whereby, the egg is kind of developing outside of where it's supposed to be, and this is called the ectopic pregnancy. Usually with ectopic pregnancy, they would have to do like a spontaneous abortion or terminate the pregnancy in order to protect the life of the mother. Also, this medication can also may cause a serious side effect of a severe lower abdominal pain. Once you start seeing this, you want to make sure that you're reaching out to your doctor immediately. Also, if you start noticing any form of jaundice as well as leg pain, this may be due to a blood clot, so you want to make sure that you're reaching out to your doctor. If you're noticing any weird starting of a side effect while you're taking this medication. So what are other things that you need to know about this medication? So this medication is contraindicated in patients, and contraindicated meaning this patient should not be taking it. So if you're a patient that have like any liver issues, or if you have like any abnormal genital pain or bleeding, you should make sure that you're reaching out to your doctor, because this is not a medication for you, most especially patients who have an abnormal genital bleeding. So you might want to reach out to your doctor in order to get that cleared. Also, in patients who have a liver tumor, this is not an appropriate medication. Also, in patients who are pregnant, this is also not an option that you should be using if you're pregnant. As like I said, this is a contraceptive medication that can kind of alter the hormones. So you don't want to take this medication, as well as patients who have breast cancer. So usually breast cancer, sometimes this patient may have some hormonal part to their condition. So this is not a medication that you should be using really if you have breast cancer, as it can worsen that condition. All right. So what are other things that you need to know while you're on this medication? So like I said, this is a contraceptive medication, and it doesn't in any way prevent STD. So you need to make sure you're using all the protective methods when, if you're sexually active, in order to protect yourself from STD. Also, menstrual spotting may occur in between your menstruation. So make sure, you might notice that you start spotting outside of your menstruation window. So let's say your menstruation is from the 5th to, let's say, the 8th or the 10th. You may start noticing spotting maybe on the 17th or on the 18th. So somewhere in between your menstruation cycle, you may notice some spotting. So make sure that you have some form of pad, or maybe like a pant liner on. That way, if you have that spotting, you're able to keep it together, and it's not just like, oh my gosh, what is going on? So also, in the case of this medication, it is recommended to start taking this medication the first day of your menstruation. So let's say you start your menstruation on the 5th, it's recommended to start it that day. Also, in patients that are just starting the medication, you want to make sure that if you are going to have sex, that you're protecting yourself or using contraception, other form of contraception, within 48 hours of starting that medication. Also, timing is very important with this medication. So you want to make sure that you're taking it about the same time every day. So if you miss this medication for more than 3 hours, let's say you take the medication at 3 o'clock and you mistakenly forgot, and you take it after 6 p.m., then you want to make sure that you're using an extra contraception for the next 48 hours. That way you can prevent yourself from getting pregnant. Like I said, time is of the essence when it comes to this medication. Also, in patients that are diabetic, you want to make sure that you're watching out for your blood glucose. Make sure that you're testing your blood glucose while you're on this medication, as well as patients who are breastfeeding. So patients who are breastfeeding, this medication is very appropriate for those patients, unlike other birth control that contains estrogen and are more likely to cause blood clots. So in our patients that have a history of blood clot, this is most likely what the doctor is going to lean towards, other than a medication that contains estrogen that can increase your chances of blood clots. All right, so I hope I was able to help in terms of what to look out for while taking this medication. Thank you so much for watching. Like I said, again, we do have that free recipe to our meal, one of our diet meal plan, and you make sure you're checking it out down in the description bar. Thank you for watching, and make sure you hit that like and subscribe button down below. Until next time.